Morning, everyone. Today I'm going to talk a bit about aging and a very specific aspect of aging. I'm not going to talk about any supplements or, you know, any sort of fad diets. All right. I'm going to talk a bit about science, right? And we all know that, our body wears out every day and it's regenerative by nature. So essentially, our body has an ability to replace and repair the damaged or dysfunctional cells, right? And as it pays out, so there is a process where no, it gets replaced and repaired, right? And our body performs normal functions, right? But to this do for this to happen, there's specific cells found in our bone marrow, in our blood, in our fat cells, in muscle, skin, liver, heart is stem cells, and stem cells are actually dormant till the time they are assigned a task to repair or replace these dysfunctional cells, right? So essentially, either they can make more cells than themselves, or they can assume a role of other cells like liver cells and blood cells, right? So these stem cells have the ability to mobilize and differentiate into different specific cells to perform or to repair and perform various functions, right? So basically, it has a role to uh, repair and replace the dysfunctional cells, right? And so for stem cells to mobilize and differentiate, right, to repair and replace, right, there's a signal required, and that signal again is nothing but nitric oxide, right? So essentially, our nitric oxide gives a signal stem cells to mobilize and differentiate to replace and replace to repair and replace cells, dysfunctional cells, right? So nitric oxide again has a role to play. If our cells cannot be replaced, repaired, and they're more of dysfunctional cells, we start to age and we have all sort of age-related diseases, including the metabolic diseases, right? So nitric oxide has a role to play in your aging, both from a perspective of, expressing PGC1 alpha, which leads to mitochondrial biogenesis, and which also the mitochondrial function and telomere, preventing the telomere shortening, right? So apart from that, countering inflammation, oxidative cells, these all are the things which we have discussed in our previous webinar on nitric oxide. But this is very specific. I'm talking about stem cell. It is a signal. Nitric oxide is a signal for stem cells to replace and to repair cells and replace to mobilize and differentiate into specific cell types, right? So essentially, if there's a functional loss of nitric oxide production, right? So essentially, it could make stem cells when they're dysfunctional and or you would age and it would lead to a lot of chronic health issues, right? Uh, as we age, right, the availability of stem cells in bone marrow and blood starts to decrease, fall down. And we all know that as we age, we also try to build a lot of fat, right, inside our fat cells. So fat cells become a quite a big reservoir for these stem cells, right? But if so again, we know there are stem cell therapies, there's stem cell banking, a lot of these things where you can store stem cells, we can then inject, right? There's a normal process which could bring the indigenous cells back in the body to perform all these issues of repairing the damaged cells, right? But if you have obesity or probably your gut microbiome imbalance is triggering production of a lot of endotoxins such as TMO, LPS, puts and a lot of these things they could store in your fat cells, especially LPS, lipopolysaccharides. And again, when there is a lot of toxins being stored in your fat cells, because body is again very smart, so it will not allow the toxins to float inside the body, and it will be stored somewhere and stored with the fat cells, and again you become obese and you gain fat, and right. So this also have a cascading effect on making stem cell dysfunction. So ideally, if you are obese or you are really overweight, right? Probably there's a lot of toxins being stored in fat cells. So should focus on eliminating the inflammatory activities, other performed by oral gut microbiome, right? To actually help you lose weight, right? So again, lose weight is not about calorie counting. So toxins is the molds and toxins is not about calorie counting, right? It's all about the your biochemistry and how your microbiome is converting various food substances into other nutritive toxins. These toxins get stored in your fat cells, right? So essentially, the focus is to suppress the inflammatory activity and promote the anti-inflammatory activities, right? Put them back at your microbiome, right? So this is really important. So few things, have a lot of green vegetables because it is source of nitrate and which could be used by oral microbes to convert to nitrate, which mixes the stomach acid to produce nitric oxide, right? Do not take mouthwashes, do not use mouthwash, do not use toothpaste which are high in fluoride, do not take antacids, do not take PPIs, no statins, right? These are few things you should take care of when you think you're aging probably more than yeah, your biological age is higher than your chronological age probably, you have a low nitric oxide production. Probably we measure the nitric oxide production by using the biochemical functions performed by your oral microbiome. Right? So essentially, to make your stem cells do their job, to either multiply themselves or play a role of other cells, or probably repair and replace dysfunctional cells, right? To make your body be regenerative, right? So essentially, you need to focus on optimizing your oral microbiome function, optimizing gut microbial functions, making sure your body is producing enough nitric oxide, right? Avoid using PPIs and acids, right? Have a lot of green vessels which are high in nitrate, which can be used to produce nitric oxide. Avoid fragile fatty acids such as those found in seed oil, vegetable oil, right? So these are the few things you should understand from one of the aspects of aging, which is again, the functional stem cells, right? So again, stem cell therapy also you may go, but again, if your body is not producing enough nitric oxide, your stem cells may not work, right? So so take the right choices if you really want to understand your unique biology at a molecular level, what your microbes are doing, how they're interacting with your body organs, how they're interacting with the mitochondria. Probably we can help you with that. We are the only company in India who focuses on the genes, especially on the biochemical function performed over in that microbiome. So we can tell you your nitric production, we can tell you LPS production, we can tell you TMA production, your byproduct production, and all these things. Not only potentially, actually, we are measuring the actual production, right? We are not just telling you the potential to produce, but we are actually telling how much is actually being produced. So that's it today. Have a good day. Thank you very much.